Welcome to the innovative modalities in cancer treatment.
The 5.9 centimeter mass was gone. I was actually, at this point, I was surprised myself. No? How can it happen in just a span of 1.5 months? So I asked them, what did your uncle say about this mass? Their uncle said that, yeah, indeed, the tumor was gone. It's just a cavity. It's non-enhancing. So, it worked. Okay.
Right? Now you know. Cancer eats what? Cholesterol. Right? Simply Nature people can lower what? Cholesterol. Now you understand why you're taking the tablets? Make sense? Yeah, so more powerful than I tell you this miracle product. Just buy, eat, cure. No, we shouldn't do that, right? Because cancer is not a stationary disease. It keeps changing. So it's best that you understand what's happening. All right?
Especially if we are talking about solid tumors. The number one modality of treatment is surgery. Then to prevent recurrence, then we do the other adjuvant treatments like chemotherapy, immunotherapy, or targeted therapy, and also radiotherapy.
I have learned the innovative modalities that can be offered to my mom. Tapos on how to take care of ourselves also. Siguro si mom pwedeng sa powder, ako po pwedeng sa PPARS Plus naman.
Yes, I will invite friends and family members na umattend sa ganitong klase ng ano. Kasi masaya ako eh. Para bang ano, kasi masaya yung outcome, yung staff, helpful, friendly, plus yung yung panelist responsive sila sa mga tanong, tapos very honest sila sa mga sa mga pagsagot sa mga questions. Basta nasasayahan ako, ganun.
We're always with you from start to finish.
Magandang araw po sa inyong lahat. Ako po si Sheila, ang inyong host, at narito po tayo muli sa Simply Nature Success Stories. Napakapalad po natin ngayong araw dahil napaunlakan po tayo ng isang lung cancer patient na may very inspiring story na ibabahagi po ngayong sa ating lahat. Magandang umaga po, Ma'am Violeta. Salamat po sa pagpapaunlak niyo sa amin ngayong araw na ito. Maaari niyo po bang ipakilala ang inyong sarili sa ating po mga manunood?
Okay. Sige, salamat sa inyo. Ako po si Violeta. Magsi-67 years na ako. Na-diagnose po ako nagkaroon ako ng lungs cancer na stage 3C. Halos stage 4 na daw yun. Ay, nung 2022, nag-ubo-ubo na ako pero gumaling. Tapos nung 2023, inuubo na naman ako. Hanggat sa ang plema ko is may dugo. Hindi ko yun sinabi sa mga anak ko. Nilihim ko yung gawa nga ng akala ko TV lang. Mga buwan ng May, sinabi ko sa kanila. Alam naman nila yung naubo ako eh. Pero sabi ko, hindi na maganda. Ang sabi ko, may dugo na yung may dugo na yung plema ko. Di pina-x-ray nila ako, mayroon ng findings na mayroon bukol ang lungs ko. Ang ginawa naman ng doktor, naman ako, CT scan with contrast. Yun nga, nakita ang bukol sa sa lungs ko is malaki na. Hanggat sa napansin ko naman na mga buwan ng June o July, mayroon na akong nakapa dito mga bukol. Sa liig ko binayopsy. Hanggat sa dumating ang result ng biopsy after 2 weeks, hindi na maganda. Dahil nga sa mayroon akong lungs cancer, stage 3C. Ayaw ko kasi magpa-chemotherapy noon. Pero dito sa bahay, nagpakuha ako ng oxygen tank, malaki. Hindi na ako nakakakilos kasi noon eh. Halos nakahiga na lang ako, pupunta ng CR, pagbalik ko salpak agad ng oxygen. Dahil sa grabe na nga. Talagang ang isip ko, kung anong gamot ang makakalunas.
Kayo po ay gumamit ng Simply Nature PPARS. Ano po yung mga naramdaman yung kakaiba o pagbabago?
Nung dati pa man, bago ako binayopsy, na nagsisimple nature na ako siguro mahigit ng 1 buwan, Maganda dahil yung dugo ng plema ko nawala doon sa PPARS liquid. Nawala yung dugo. Hanggat sa ma-biopsy nga ako, mabigyan naman ako ng yung gamot ng biopsy, magaan na ang pakiramdam ko kasi wala naman ng dugo.
Naisabay po ninyo itong Simply Nature PPARS dun sa GPT po na yung targeted therapy po na nasabi ninyo kanina. So, nagkaroon po ng magandang improvement sa loob po ng isang buwan, tama po?
Mula nung mag-PPARS liquid ako, na mga nakakailang box ako, nawala yung dugo sa plema ko. Yun naman ang guminha-ginhawa ako. Hindi, ang pagdating ng result ng biopsy at naresetahan ako ng gefitinib, ang bilis lang. 4 na beses lang akong nakainom. Nawala na yung ubo ko, nawala na yung plema ko.
Para po sa kaalaman ng lahat, ang isa po sa maganda sa Simply Nature PPARS is kapag po ito ay naisabay sa conventional treatment, kagaya po ng chemotherapy o kaya po prescription medicine po na pre-prescribe po ng mga oncologist, ay may pagkakataon na mas napapalakas po natin yung bisa or yung effectiveness po ng mga gamot na ito at mga treatment na ito, lalo na kapag kasabay po ng PPARS. So, I think ganun po yung nangyari po sa inyo.
Kasi bago pa man ako na diagnose ng may lungs cancer ako, ayon doon sa biopsy, nainom na ako ng PPARS liquid, saka PPARS ng tablet. Nawala yung plema ng dugo ko. May 1 buwan na rin. Ang ganda ng epekto sa akin. Ang sigla ko na, 1 buwan, 1 linggo. Hindi na ako nahingal, hindi na ako nag-o-oxygen.
After po nun, so nagtuloy-tuloy po kayo ng gamit din po ng Simply Nature PPARS?
Hanggang ngayon, nag-Simply Nature pa rin naman ako for prevention. Na pampalakas din ng resistensya. Hanggang ngayon, nag-iinom pa rin naman ako.
Pati po yung mga nodules o yung kulani po ninyo, o bukol sa leeg, ay nawala.
Nung nainom na ako nung gefitinib, yung mga bukol dito na nagdamihan, ang dami po na talaga dito ng bukol. Awa ng Diyos. Unti-unti na rin yun, araw-araw, kada umaga, kinakapa ako, ang liig ko nawala. Pero tuloy-tuloy pa rin naman ng inom ko nung PPARS kasi yun nga ang nakakaganhawa sa akin. Pag nakakainom ako noon, medyo malakas, parang maginhawa bang huminga. Kahit may iniinom naman ako ng hindi na ako hindi na ako nag-oxygen. Kasi nga maginhawa na ang paghinga ko. Hindi naman sa wala akong tiwala sa mga chemotherapy, pero ang dami ko na kasing nakikita na mas lalong daming naaapektuhan ng chemotherapy. Kaya ang ayaw ko talaga ng chemo, hanggat maaari gusto ko na lang yung alternative medicine. Yun na nga, di naman din ako nagpabaya na binibilhan naman ako ng mga anak ko ng mga daming mga herbal. Pero ang naramdaman kong mabisa o maginhawa sa pakiramdam ko ang PPARS. Kaya yun ang tinuloy-tuloy ko. Basta ako mahigpit akong sinasabi ko sa kanila, ayaw ko ng opera. Ayaw ko din ng chemo. Kasi hindi ko kakayanin na yun. Mag-antay-antay tayo ng panahon kung i-effective itong kasi ang tinira ko na lang, hindi na ako nainom ng iba pang mga alternatives. Sabi ko, ito na lang, dahil ito ang nakakaginhawa sa akin, PPARS nga.
Last January, nagkaroon po kayo ng CT scan. Ano po yung dumabas na sa CT scan ninyo netong January po?
Sa CT scan nitong January, ito lang 2024, is maayos na. Hindi na, wala na yung mga bukol. Kasi kahit si Doc Jansen naman noon, gusto niya na rin ako ma-CT scan para daw malaman, curious daw siya kung ano daw yung nangyayari na sa bukol ko. Maayos na, wala na yung mga bukol. Parang cavity na lang daw yung naiwan ng mga pinag-alisan ng bukol. Yun.
Dito po. So parang ito yung parang naging resulta po, nung pag-combine po ninyo ng PPARS at saka po ng GPT po this past months po. ano po yung mensahe na pwede nyo pong maibahagi sa kanila sa mga katulad po ninyo na nasa kalagitnaan po ng cancer journey?
Laban lang. Huwag tayo mawala ng pag-asa. Ang cancer, nagagamot. May Simply Nature, may PPARS, maganda. Yun talaga ang naranasan ko na guminhawa talaga ako. Nung medyo inatake ako ng todo, gusto ko uminom kaagad, kaso lang inom ko lang. Dahil yun ang maginhawa sa pakiramdam ko na pag inuubo ako, nakakaginhawa naman talaga.
Ma'am Violeta, maraming salamat po sa pagpapaunlak niyo sa amin at pagbibigay po ng panahon para maibahagi niyo po yung inyong inspiring story po no, sa ating mga kapwa-pasyente na nasa kalagitnaan o may pinagdadaanan din pong laban against cancer.
Ay, ako si Violeta, 67 years old. Na-diagnose po ako ng lungs cancer, stage 3C. Dati po, hirap ako sa paghinga, naubo, at ang plema ko lumalabas, maraming dugo. Talagang hindi ko na rin alam kung paano. Nung mag-take po ako ng Simply Nature's PPARS liquid at PPARS tablet, maginhawa po ang aking pakiramdam at nawala po ang dugo. At sa ngayon, hanggang ngayon, maayos na po ang pakiramdam ko. I trust Simply Nature. Maniwala po tayo.
Welcome to the innovative modalities in cancer treatment.
The 5.9 centimeter mass was gone. I was actually, at this point, I was surprised myself, no? How can it happen in just a span of 1.5 months? So I asked them, what did your uncle say about this mass? Their uncle said that, yeah, indeed, the tumor was gone. It's just a cavity. It's non-enhancing. So, it worked. Okay.
Right? Now you know. Cancer eats what? Cholesterol. Right? Simply Nature people can lower what? Cholesterol. Now you understand why you're taking the tablets? Make sense? Yeah, so more powerful than I tell you this miracle product. Just buy, eat, cure. No, we shouldn't do that, right? Because cancer is not a stationary disease. It keeps changing. So it's best that you understand what's happening. All right?
Especially if we are talking about solid tumors, the number one modality of treatment is surgery. Then to prevent recurrence, then we do the other adjuvant treatments like chemotherapy, immunotherapy, or targeted therapy, and also radiotherapy.
I have learned the innovative modalities that can be offered to my mom. Tapos on how to take care of ourselves also. Siguro si mom pwedeng sa powder, ako po pwedeng sa PPARS Plus naman.
Yes, I will invite friends and family members na umattend sa ganitong klase ng ano. Kasi masaya ako eh. Para bang ano, kasi masaya yung outcome, yung staff, helpful, friendly, plus yung yung panelist responsive sila sa mga tanong. Tapos very honest sila sa mga sa mga pagsagot sa mga questions. Basta nasasayahan ako. Ganun.
We're always with you from start to healing.
Hi everyone, I'm Sheila and welcome to another enlightening episode of Simply Nature webinar. This program is brought to you by the collaborative efforts of Simply Nature International and Simply Healed Medical Group. Just to recap on our last week's topic, last episode we discussed the facing cancer diagnosis head on, benefits of taking immediate action. Lots of questions were asked and most importantly answered by our experts. And this week, discover how cancer patients can benefit from using PPARS because tonight's interesting topic is entitled Lung Cancer Challenges and Solutions. Today, we'll explore the latest advancements in the diagnosis, treatment, and research. Our experts will provide valuable insights into the complexities of this disease and discuss cutting-edge therapies. Join us as we delve into the innovations and challenges in the fight against lung cancer. We extend our sincere gratitude to each and every one of you for tuning in tonight to this webinar, and we encourage each and every one of you to please share this event to your friends and loved ones who will benefit from the insights shared here tonight. So, without further ado, please note that we will be having an AMA or Ask Me Anything portion after the discussion. So, leading our discussions tonight are distinguished health experts. First up, I'd like to introduce a successful entrepreneur and seasoned international speaker from a wide range of topics from personal success to healthcare. He is the CEO and founding director of Simply Nature International and the PPARS expert, currently joining us all the way from Singapore. Let's all welcome Mr. Shyan Lim. Good evening, Sir Shyan.
Hey, good evening, everyone, and good evening to our regular participants and viewers. So this time tonight, I'm actually coming not from Philippines, BGC, but actually back in Singapore. So a big good night to a big hello to everybody. Good night sounds like goodbye, you know. And tonight's topic is really good. It's about lung cancer. You know, for many people, you may not know lung cancer is actually one of the most common cancers in the world. All right. Only this year in Philippines did breast cancer actually overtake lung cancer. So lung cancer is actually quite common. Okay, and I just want to say a big hi to all those who saw us at the SMX. And you know, Sheila, our SMX was actually overflowing. We had to pull in new chairs, I think. And so that was really good. Thank you everyone for your support. Dr. Jansen, Dr. Jimmy Katapia, and myself, we really thoroughly enjoyed everybody's company, enjoyed everybody's support and all the wonderful questions. So tonight we're going to have a great AMA. Dr. Jansen is here with us tonight. So I look forward to all the questions and hearing from his answers as well. So let me hand the time back to Sheila so that we can begin our program proper.
Thank you so much, Sir Shyan. I'm very delighted, as mentioned by Sir Shyan, because at this early on, I'd like to thank all those who attended our hybrid cancer seminar last July 27 at SMX Convention Center at SM Aura. We would like to say thank you for those who for joining us in the Beat the Odds Medical Nutrition, Oncology, Surgery, and PPARS in Fighting Cancer. Your participation and enthusiasm were vital in making this event a success. So once again, thank you for those who attended the on-site and also the Zoom setup. Thank you so much. All right, so for our next, onto our next health expert, it's an honor to present our esteemed speaker, Dr. Jansen Kalalan, a distinguished graduate of St. Luke's College of Medicine. Dr. Kalalan is a diplomate of the International Board of Lifestyle Medicine and Philippine College of Lifestyle Medicine, currently serving as a consultant at renowned institutions, including Alta Integrative Medicine and Wellness Complex, Tree of Life Wellness Center, Centro Holistico, and Simply Healed Medical Group. Dr. Kalalan specializes in the treatment of cancer and metabolic illnesses. So please join us and welcome and watching our discussion for tonight. Let's all watch this.
Good evening, everyone. First, before I start, let me just share my screen. This would be a very short patient case. So please listen carefully because shortly we're going to proceed to the Ask Me Anything segment. Okay, and I hope everybody gets encouraged by this patient of mine's result. Okay, so just a recap. This patient was diagnosed. She's a 65-year-old female. She was diagnosed with lung cancer on the right with a staging of stage 3C. Likewise, she's also pre-diabetic and have high blood cholesterol levels. Okay? So, during the first consultation that she had with me, I prescribed her with this protocol, no, PPARS liquid, tablets, and also megadose IV vitamin C. Okay. Now, for the lifestyle intervention, it's basically a whole food plant-based diet. However, it is not a solid. She can't eat solid foods because she has shortness of breath. So essentially, I was prescribing her with only a liquid diet. Okay, she was eating primarily a liquid diet, or rather drinking. Okay, so on September 12th, a chest CT scan was done. Okay, this was I think this was a follow-up already, no? This she A 2 centimeter mass was found. Okay, this was the baseline actually before we started treatment. Okay, and a week later, a week later, yes, it's a week later, no? A week later, she reported still with chest heaviness, especially on the night after she received megadose IV vitamin C. And this chest heaviness persisted for 2 days until she took PPARS liquid. Now, I just want to explain, no, why this effect happened. So, megadose IV vitamin C vitamin C, if you think about it, it's an antioxidant, but at very very high doses, it acts as an oxidative um it basically acts as an oxidative agent. Okay, so if it acts as an oxidative agent, mainly we're utilizing that character of vitamin C to kill the cancer cell. Okay. Now, however, because of the very high dose, no, she developed some side effects. But what's amazing is this side effect went away when she took PPARS liquid. So this is an evidence actually that number one, PPARS liquid is a very strong antioxidant. No? So it counteracts the effect of the oxidative power of megadose vitamin C, and of course, it is readily absorbed in the body. Okay, so this is uh, a confirmation with the product of Simply Nature. Okay, now let's go into some vital statistics, no? Or vital signs rather. Vital statistics. Number one, her O2 saturation was ranging around 87 to 97. When she exerts herself, it goes down to 87, which is this is quite low actually. What is normal is 95 and up, no? So 87, that's quite dangerous, okay? And it is also one reason why she nebulizes once in a while, okay? And actually, at the clinic, when she went to me, when she followed up, her pulse rate is at 110. So her O2 saturation was 93. So she really has difficulty breathing, okay, or shortness of breath. All right. So at this time, we proceeded to give her megadose vitamin C at 15 grams and also some medication to help her breathe a little bit better. Okay. So a week later, she followed up again. At this time, still the patient reports shortness of breath. With this respect, there was no improvement. When I listened to her lungs, there were still wheezing, no? So it seems that there wasn't significant improvement when it comes to this. Okay, still she was on PPARS liquid. Um, take PPARS liquid every day. Okay, so at this point, I decided to double the dose of vitamin C up to 30 grams and see if she was able to tolerate it. During this visit, she was able to tolerate it, okay, actually quite well. Now, the following week, on follow-up, there was shortness of breath. Uh, the breath sounds are still not good, okay, on both lungs. However, what's amazing is the wheezing went away already at this point. Okay. This is a very significant response because if you hear wheezing in both lungs, it means that the airway is narrow. Okay, so the tumor is still, of course, blocking her airways. That's why you hear wheezing. When the wheezing is gone, this is a very significant uh, improvement because on top of my mind, I will think that the tumor might have decreased in size. Okay, because the airway went back to the airway increased in size again. Okay. However, there were still RALs, no? The RALs happens or a doctor will hear RALs if there are a lot of mucus inside the patient's lungs. Okay, so that might be one reason why we still hear RALs. Okay, also, the patient noticed softening of her neck masses. Okay, she had two very large lymph nodes on just above her clavicle on the left and the right, no? And the patient noticed softening of these two neck masses already. And the neck masses were actually biopsied. A biopsy was taken, which showed really a metastatic adenocarcinoma. Okay, so with this, her oncologist decided to give her gefitinib once a day. This was prescribed by her onco. Gefitinib is a targeted therapy medication. Okay, so with this, since the patient is already on targeted therapy, the role of megadose vitamin C will be gone already. Okay, so we decided to stop megadose vitamin C, and we just proceeded with ozone therapy or IBU. Okay, now. Later on, if you are curious, maybe you can raise the question what is IBU. We'll explain it to you later. Okay, so they'll continue with the PPARS. Okay. Now, on the following week, okay, the patient has no shortness of breath already, okay, which was really amazing. Okay. Uh, yeah. Well, after 2 weeks, no. So her O2 saturation was at 99, which is really wonderful. Okay. She can tolerate eating solid foods already. When I listened to her lungs, it was clear. Okay? There was no rals, there was no wheezing. Although there are some areas of her chest that still has decreased breath sounds though, which might be the tumor. Okay. However, one thing that is really very significant is she doesn't have wheezing anymore. She doesn't have rals as well. And there's also a decrease in size of the enlarged lymph node on her left shoulder. Okay. And the lymph node on her right was gone. Okay, which was this was really quite an amazing finding. Okay, an amazing improvement at that. Okay, so a few weeks earlier, she went for follow up again. She underwent the same EBU. At this time, there were no shortness of breath again. So the improvement was consistent. And this was the most significant improvement of all, no? Um, Remember, November 7 was just after the long weekend. So everybody was going to the province. Lo and behold, her daughter, I think her daughter or somebody forgot to bring the duo-vent. Okay, this is the nebulizer to make her breathe a little bit better, no? They forgot to bring it. So essentially, the patient was not nebulizing at all for 3 days. However, the patient was able to tolerate without nebulizing. She did not have any episode of shortness of breath, which was amazing. And she was able now to climb one floor without fatigue. Okay. So this is a very significant improvement actually. And lastly, the palpable lymph nodes on both of her shoulders were gone entirely. So right now, we're planning to repeat her chest CT scan on January 2024. So stay tuned. We'll see how significant her improvement is once we get a chest CT scan, a repeat chest CT scan. Okay. So that's it, everyone. Thank you for listening. I hope you get encouraged with with my patient's improvement, no, which is quite significant. This just goes to show that if you combine all the modalities that we know that can help a cancer patient, we get really good outcomes, even though the stage of the cancer is quite advanced already. Lung cancer at that. And lung cancer at stage 3, the prognosis is not good. Okay, trust me. Right, so let's go ahead with the AMA segment. Okay, thank you, everyone.
Once again, you are watching the Simply Nature webinar. At this point, I'm sure that you have learned so much from the discussion brought to you earlier. So we are now in the Q&A portion, or what we call AMA or Ask Me Anything portion. So let's not keep you waiting, because I can see some questions coming in. However, before we call on the experts who will answer our questions, I just first want to greet our viewers for tonight. Starting off, of course, with Miss Minda Banela. Good evening po. Miss Noemi Veras, Salia Boganvilla. Thank you so much for joining us. And Aimee Chuachiko. Thank you so much. Please just keep the questions coming. And even in Tagalog, yes, pwede po. Okay? Now, of course, to answer all the questions for tonight in this modern world filled with noise of different health opinions, trust the ones from the experts. So let's not keep you waiting. I'd like to call on once again Mr. Shyan Lim and, of course, Dr. Jansen Tantalalan. Good evening, Sir Shyan, and good evening, Dr. Jansen.
Good evening, Sheila. Good evening, Doc. Greetings from Singapore.
Hi, Sheila. Hello, Shan. Happy to be here. Hello, everyone. Good evening.
There you go. All right. I'm sure that some of our viewers were also some of them were attendees of our SMX event last Saturday as well. Okay. Now at this point, our first question coming from Mr. Christian J. Ledores. I bought the PPARS liquid for my mom. Unfortunately, no, not this one. Sorry. Unfortunately, the tumor still grew. What other PPARS can I take?
Usually, when PPARS liquid is already being given, no, then we must some other treatment must be done aside from the PPAR. So this is in a case wherein a single supplement or a single treatment is not effective anymore. So other treatments has to be considered. Okay, so this is also one reason why I usually tell my patients, no, it's the approach for cancer treatment should not be monotherapy, meaning you should not be using a single tool only. It should be a combination of different tools so you get the best outcome. Okay, because these different tools work hand in hand actually. Okay.
Yeah, I just wanted to add that number one, a few questions is how long has he been using the liquid PPAR? Is it 1 box, 2 box? Is it 10 days, 20 days? There is also my next question will be, what was the dosage that the person is taking, the patient is taking? And last but not least, what other protocols and approaches is the patient doing? All right, so here are a few of my feedback in general. If the patient is in a late stage cancer and is on a mono protocol because of your personal choices, like for example, some people might be due to the age, they don't want to be doing any other therapy, or for whatever reasons, if they're actually just using supplements as a mono protocol, main protocol, and Simply Nature liquid is one of the key things that they are using, then we can also look at the dosaging. I believe, Dr. Jansen, you actually have some patients who take more than 1 vial a day. Yeah, right. So that might be one thing also. Now the tumor grew. Okay, so this result this result is not enough. Okay, because I would also want to know, was the tumor growing quickly? Did the speed of the tumor growth actually change? Did it grow less than the last 2 times? Maybe in January, the tumor grew maybe when you did your first scan, let's say in June or May, and then in June it grew a lot, and then you just did another scan in late July, and it still grew, but it didn't grow as fast as previously. So all these are possible information that we will need to have a better picture. So, all right. So I would suggest that you go for a consult with Dr. Jansen. And then in that process, in the consult, or check these questions that I'm actually asking. Okay, because if your cancer tumor size is to improve, it will have to go through a few stages, right? If your tumor was growing, it has to slow down its growth, it has to stop, and then it starts to shrink. It's just like a car going for a U-turn, diba? You have to slow down your car and then until you come to almost a full stop before you make the U-turn and you go the other direction. So we just have to know which part is it. And of course, next, are you using any other protocols? What other protocols are you using and what other protocols can you use? So I totally agree, Dr. Jansen. Cancer is not a mono protocol thing, but you could have a primary approach, which is your main way of attacking the cancer. But you should always keep your eyes open and your hearts and minds open to other approaches. And of course, I pray that you're actually taking the tablets. You're taking the tablets as well. Okay, so that's important. I just want to highlight to everyone what Dr. Jhen, when we see data like this, it's we have to be a bit more. We have to look at it correctly. So I'm going to share a personal experience that I had today. I'm in Singapore for a few reasons, but one of the reasons is I'm accompanying my mom to see a specialist. So yesterday I saw her neurologist, and today I saw her brain surgeon, right? So it was very interesting. She had MPH, so she did a tap test. So to check, because there's pressure built up, fluid pressure built up in her at her brain area. So she did a tap test. So the neurologist actually said that, okay, they did a spinal drain, spinal drain, and then there was improvement. But because my mom's walking is pretty good anyway, so the improvement was very minimal. So the neurologist was saying that it's a gray area. You could do the actual shunt to have surgery and put a shunt there, so to drain out the liquid, all right, so to reduce the pressure. But there won't be much improvement because anyway, she's walking well. So that's his view, but he said, go and see the neurosurgeon. So the neurosurgeon that I saw was actually is the best in Singapore. And I'm very fortunate because my family member is also a surgeon. That's why we were privileged enough to have the best neurosurgeon. And he was sharing with me, he was saying, yes, it is true that the physical improvement is not going to be much. But he did say this. He did say that MPH over time, for sure, very likely will develop into dementia. So 5% of dementia is the type that comes from MPH. So then he said, so he advises to really consider the shunt, not because of the improvement of the walking that can be achieved, but actually because as a preventive for the development of dementia, because my mom is already 75 years old, right? So there again, that's why I'm bringing this up is you can see we were very focused about the walking and everything, but the surgeon asked us a different question and saw what was important, right? Which is the prevention of dementia. And then we as a family, we then make a decision that we're going to install the shunt because the surgery is very low risk and we have one of the best surgeons. And the purpose is not to help my mom walk better, is to make sure that we totally eliminate this avenue of dementia in her life. And that to us as a family is something that we're more concerned about. Right. So I think this is very interesting how as you talk and you converse and think about and discuss with excellent doctors like Dr. Jansen, Dr. Jimmy, you will see that the things that you look at from diagnostics can have a very different understanding and interpretation. So I advise you, after my long story, go for a consult. Yeah,
would
I don't
be.
know, Doc. That was my experience today. It was very enlightening how we were looking at one thing. Then I asked the neurosurgeon, right? I said, so basically, my mom caught a cancer at stage 0. We are able to nip it in the bud. So yeah, it was a very interesting conversation.
Thank you, Sir Sean. Thank you, Doc Jansen. For those of you who wish to have a consult with Doc Jansen, please simply type in how to consult. Our healthcare specialist, Miss Beth or Miss Irish, will definitely get in touch with you. Or you can also visit or just comment. Also on the comment section is the link on how you can book a consult with him. Okay. Next question. Thrown to us privately by one of our viewers. Please. My case is orbital lymphoma. I finished 3 cycles of chemo, did not undergo radiation anymore. What dosage or kind of PPAR would you recommend? My hemoglobin is very low.
Can you repeat the
Okay.
question again? Did the patient undergo chemo or
Finished 3
did she
cycles.
discontinue?
Uh,
She finished 3 cycles.
yes, yes. Finished 3 cycles, did not undergo radiation anymore.
Okay, the next question is will there be more chemotherapy sessions that she would be undergoing? Because if she will be undergoing additional sessions, the PPARS powder, I think, would be a better product, no, for her to take. Yeah. For if it's just all 3 cycles that was uh that the oncologist plan to give, no. So at this point, the goal of the treatment is to rehabilitate. It's to help her recover from the damage of the chemotherapy. So at this point, um products like soft gel capsules would be enough already. So it really depends on where she is already at the treatment in her journey. Okay, but if there are so basically, if there are still more chemotherapy sessions that the oncologist plans, it would be best for her to be on the powder. Okay, so that's how I would advise her how I would advise her. But I still need to know her other health parameters for me to be able to make a better recommendation. So yes, go for a consult, I think. No, yeah.
I think tonight our conversation is because guys, this is why you missed the SMX. You should have come for the live Q&A because if the live Q&A is not like you're typing a question, then Dr. Jansen answers. He's able to ask you. You have the mic, yeah. Then you can immediately answer the details and move on. And it will be more interactive, right? But of course, we are very happy to be able to do at least this. But I really encourage you the next time we do a next SMX, be there live, so that you can really ask all your questions in an interactive manner. Yeah.
Yes, this is also the reason why you should follow and like our page so that you can keep yourself updated with the latest events that we are having here in Simply Nature. All right.
Sheila, I just wanted to say, for the first viewer who asked about the liquid, okay, so I just want to also point him to certain things to notice, right? Normally, if you just had a box of liquid, obviously, if you just have a box of liquid or maybe 2 weeks of liquid, you may or may not, if the tumor already shrunk with 1 box of liquid or 20 days of liquid, that's amazing. Imagine chemotherapy, you have to do so many sessions over months, yet you can see results in 20 days. That's pretty amazing already. So if it's less than a month, and you don't see like huge improvements, I would want to also direct you to a few things to look out for. Like for a lot of patients, their level of energy, right? How well they are feeling. Is there an improvement in the pain, in the energy level, in the clarity of the thought, in the movement of the patient? So all these things are also important, and you've got to give it time. So again, we have to look at the dosage, either increasing the amount of liquid extract. But if you increase the amount of liquid extract, financially, it might also be more challenging. So the strategy could also be to switch to powder so that you can increase the dosage. um, a lot of possibilities. So again, go for a consult so that you can get your answers. But we are going to be with you, as we say in our program, and Simply Nature, always with you from start to healing. So we will walk this journey with you.
Exactly. Thank you, Sir Shyan. Thank you, Dr. Okay, for our next question, turn to us also privately. For 35-session radiation therapy and weekly dose of chemotherapy during radiation due to nasopharyngeal wall with shallow bilateral Rosenmuller fossa with bilateral neck nodes. Currently taking 2 scoops of powder, PPARS powder twice a day. Can he continue taking it?
Yeah, I think he must continue taking, no? However, this kind of cancer, a biopsy has to be properly done. Which type, no? I actually saw this patient. Yeah, yeah, I actually saw this patient. Um, and he told me that the doctors had trouble identifying what kind of cancer he has. Okay, but ultimately, I think they were able to zero it down to nasopharyngeal carcinoma. Okay, so that's the reason why they recommended a combination of radiation therapy and chemotherapy. So if this is the treatment protocol of the patient, and by the way, the patient is quite strong. When you see him, you won't actually notice that he is sick. Okay, so at that point I recommended the powder, but I increased the dose to 5 scoops 2 times a day. Okay, I find this is based on my experience, but I find 2 scoops 3 times a day or twice a day a little bit low in terms of impact. So I increase it to 5 scoops twice a day. And by the way, 5 scoops, I think, is almost equivalent as 1 vial of PPARS liquid. Yeah. Okay. So
Sir Shyan, you're
what
on
I
mute, I think.
Oh,
Sorry.
I said, just to confirm what Dr. Jansen said, if you take 5 scoops 2 times a day, yeah, it's quite close to the liquid. Yeah.
Yeah. But of course the concentration is different. So they're not equivalent, okay? I just want to let the audience take
Have a
note of
feel.
this, no? And even my patients, no? Because the concentration is different. So it's not equivalent, okay? You need way more scoops, no, to have the same concentration of the liquid. Okay? So, having said this, another consideration is it's in the nasopharynx. So, if you take the powder, you would dissolve it under the tongue. So, in terms of proximity, it's quite near the tumor. So, that's what I recommended. Here's a problem that we have. The plan for the patient is radiation therapy. So, right now, he's okay with the powder. But once he starts with the radiation therapy, everything neck up will dry up. So he's going to have difficulty taking the powder. It's gonna stay on his mouth. He's gonna have trouble dissolving it. So
Yeah.
what I did was to during this time, no, is to advise him to take the liquid, because with the liquid he's just gonna swallow, and the liquid would definitely be able to help with the inflammation that he's going to experience with his throat, because he's gonna swallow the liquid. Okay, so the liquid will touch the skin of the esophagus directly. It's to help the inflammation. Okay, and the only challenge that I am seeing that might happen with this method is if he when he swallows the anything, no, liquids, no, he's gonna have pain. So if this is so, then another that's gonna be another challenge. So we have to discuss again on how we can change take the liquid. Yeah, but that's a problem of the future when it happens. Okay.
Yes. Plus also, Doc, no, there's also possibility that in just one day, both the chemotherapy and radiation is done together, correct?
Yes, 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 yes. There are, yeah, this is called concurrent chemo radiation therapy. So why do we give chemotherapy at the same time radiation therapy? Is it too taxing on the body? The answer is yes, it is really quite taxing on the body because you're basically using two therapies, no, treatment that has side effects that are not good. Okay. However, this is needed because the chemotherapy that they give will not only kill the cancer cells, but it will also make the cancer cells sensitive to the radiation. So usually we use cisplatin for this cases, for these kinds of treatment. And the good news is, I think Simply Nature PPARS was studied using cisplatin and oxaliplatin. Yeah.
All right. Sir Sean, would you like to add anything?
Nope, I think Dr. Johnson did a wonderful job, very wonderful job sharing with everyone.
But I just want to share, Dominic had that concurrent moment also in his learning. All right, so next question that we have here, Doc, what are the usual symptoms of cervical cancer coming from Mr. Six?
Okay. The symptoms of cervical cancer are very non-specific, so you have to be careful on when taking the things that I'm going to say. Okay, don't panic. Okay, when I tell these symptoms, this will just tell you that you have to go see your doctor, and this will not confirm if you have cervical cancer or not. Okay, because again, the symptoms are very non-specific, meaning the symptoms can come from other diseases as well. Okay, so here it goes. Number one is, of course, vaginal bleeding. Okay, so in between your menses, you notice spotting. You also notice a discharge coming out of your vagina that is foul smelling. Okay, now other diseases like bacterial vaginosis can cause this. Okay, so don't panic. You have to go see your doctor again. All right. So another symptom is, of course, pelvic pain or pain, no, below your belly button. Okay. So if you experience this pain, again, you have to go see your doctor so your doctor can do a physical exam so on what's happening at your abdominal area. Okay. Other symptoms of cervical cancer would be, of course, you are unintentional weight loss. Okay, actually, unintentional weight loss is a common symptom of other cancers. Okay, so this is when you lose weight unintentionally. Okay, so meaning you're not going on a diet, you're not exercising too much. In fact, you might be sedentary, but you're growing thinner and thinner and thinner. Okay, so that's unintentional weight loss. These are the telltale signs of cervical cancer, and the diagnostics. No, we have to do a physical exam on you. So when you go to your OB's clinic, doctor's clinic, no, your OBGYN will do an internal examination. So by internal examination, your OB will insert his or her finger, no, into your vagina to feel the cervix, no, if there are any tumors or any masses, okay, that is present. And on top of that, of course, your doctor will also do a try to visualize the cervix. Okay, so usually cervical cancer, the appearance of the cervix can be bloody. There can be white spots, there can be ulcerations, which these signs, no, will increase the possibility of a diagnosis of cervical cancer. Okay, so those are the signs and symptoms. Again, they are very non-specific. Other diseases can manifest these symptoms. So when you feel these symptoms, this just tells you that you have to go see your doctor already.
Okay, thank you so much, Dr. Sir Sean. Next question.
No, I'm good.
All right, so next question thrown to us via inbox. I have a small lump on my right side breast, but the result is probably benign. The result is actually benign. Is it
Oh, that's great
possible?
news.
It is. But is it possible for this to become cancerous in the future?
Yes, there is a possibility. So this is what we call as a malignant transformation. So this is when a benign tumor becomes malignant. So, what are the chances of a benign tumor becoming malignant? It's actually very, very small. And this was actually confirmed by Dr. Jamie Katapia as well, no? So, however, of course, there's still this possibility. So, how can we prevent a benign tumor becoming malignant? It's by way of lifestyle only. So, make sure you are eating plenty of fruits and vegetables, a lot of plant foods. A high fiber diet is very important for this. Okay. And of course, the other risk factors for developing breast cancer, they have to be eliminated as much as possible. So another one example would be taking oral contraceptive pills. Okay, oral contraceptive pills can actually increase your risk of developing breast cancer long term. So if you are taking oral contraceptive pills, it's in your best interest to stop taking them. If you're taking them for PCOS, you have to do the necessary lifestyle changes for your OBGYN to be able to wean you off the medication.
That's very informative. Thank you, sir. Thank you, Doc Jansen. Okay. All right. Well, Jansen, Sir Shyan, is it okay
Yes.
if I read one question that we weren't able to answer last Saturday?
Sure.
Okay, that's good. Okay, so for that question, it actually is connected with the cervical cancer because the question is there an oral supplement to prevent cancer?
An oral supplement to prevent cancer.
I wish so.
I wish so, but Doc Johnson was sharing with me, and when the COVID first struck, he was the one that directed me to the fact that I think they were trying to vaccinate cancer, and that's where the mRNA vaccine technology actually came from, right? So yeah. Okay, anyway, maybe I'll give my 2 cents worth and let's see what Dr. Johnson shares after that. Okay, number one, everybody's looking for prevention of cancer. However, the answer is this, just like my mom's case. I mean, come on, let's ask all the viewers right now. How many of you want to have dementia? Nobody wants to have dementia, diba? And how do you prevent dementia? So you see, we are looking at the name. We are hoping to find some drug or some supplement that on the label says good for dementia, right? However, as you can see in my mom's case, is to deal with MPH, which is actually a fluid pressure built up, right? That's not dementia at all. That's pressure of the fluid built up in her brain. That's not dementia. But by dealing with it, we will eliminate dementia. All right. So I wanna share then, very simple. If you want to be anti-cancer, if you want to prevent yourself from getting cancer, number one, do the very basic and simple thing, right? Which is to make sure you don't develop any metabolic syndromes. Make sure you don't develop blood sugar problems, blood cholesterol problems. Because if you don't develop blood sugar, blood cholesterol problems, your chronic inflammation would probably be better managed, right? You would also, and if you have high blood, if you have like clogged arteries, right? You think it's a heart problem. It's actually an inflammation problem because your blood vessels are inflamed. So it actually traps the cholesterol flowing in your bloodstream more easily, and that's why it gets clogged up. So you see, as you try to deal with your blood pressure, you're going to attempt to deal with the inflammation. As you deal with the inflammation, you're going to manage the thing that actually are the precursors or the risk factors of cancer. So instead of trying to find an anti-cancer product, and if you ever find a product that says it's anti-cancer, it's probably lying because cancer can come from so many different directions. How can you cover it this way? So for me, I would think a good start would actually, if you're healthy, no other problems, a good start would actually be our PPAR tablets. And the reason why is very simple. The PPAR tablets help you modulate your immune response, your inflammation, right? And your blood cholesterol, blood sugar. So notice it's all the basic comorbidities that over time, over 5 years, 10 years, will become take root and develop in your body. So it's not only is our PPAR protocols a treatment that extracts a management for cancer, the tablets is a great way to keep you healthy. And you get all the benefits, right? You have a well-managed blood sugar, so you can enjoy your life, you enjoy your food, you don't have blood cholesterol problems. So again, you can move around, your blood pressure is normal, you're healthy, you're energetic, and basically you're preventing cancer from taking root in your body. Dr. Jansen, what about you? Is there one magic approach to anti-cancer?
I think well, this is not confirmed, no, or I just don't know, no, how the evidence behind this approach is. However, in theory, I think this would be a good way to start. Okay.
Okay.
So let's first understand how people can get cancer. Okay. So cancer basically happens when there is a mutation in the genes. So you have your DNA, there is a mutation there, that and the mutation, the effect of the mutation is to make the cancer cells grow and grow and grow unregulated, uncontrollably. Okay. So the key word here is mutation. How does DNA mutations happen? It's by way of free radicals. Okay, this is the environmental cause of getting cancer, no, as acquired cancer, not the hereditary. For the hereditary, very difficult. Later on, I'll tell you one way, no. But this is basically acquired cancer. Okay, cancer acquired from carcinogens. So going back, what happens is you have oxidative stress, free radicals that damages the DNA, the DNA repair mechanisms when they are damaged as well, no? Cancer happens. So actually, if you combine all cancers, the number one, the major risk factor is aging. It's age. So as people grow older, our risk of acquiring cancer increases. Okay? So now for you to be able to lower your risk or reduce your risk of developing cancer, then you have to do things that prolong aging. I won't say to prevent aging or reverse aging. I don't know if that, I think it's just a misnomer. No, you cannot reverse aging. Over time, you'll really age. But what you can do is to prolong aging. Okay. So what are the things that you have to do to prolong aging? It's eating right. Okay. So that's why I have been promoting a plant-based diet for cancer patients. Actually, for cancer patients, the default diet is a vegetarian diet. But of course, for healthy individuals, individuals who doesn't have any cancer, no diagnosis, or there's no family history of cancer, then eating in moderation, I think, would be a sound approach. No, so meaning the foods that you're eating are still plant-based or plant predominant, but it's okay to eat a little bit of animal food products here and there once in a while. Why? Because we need the protein, okay? Because if you are on a vegetarian diet for a very long period of time, when you age, no, you need more protein. And what happens is the risk for dementia will increase. So you're cancer-free, but you won't even remember at all. So it's a balance, no? It's a balance. So over time, you have to consume. There's really no way, no, you have to consume animal food products, because or else you'll develop muscle wasting. Okay. So on top of this, of course, physical activity. Physical activity is very important when you are young. You have to start young, because when you are already in your senior years and you are weak, there's no way for you to be able to strengthen your body by doing exercise anymore. Why? Because the recovery time of your muscles is so long, so you're gonna feel tired all the time. You'll be trying to recover all the time. So you'll be sedentary, no, instead of physically active. So you have to start early. On top of that, if you don't use your muscles when you're young, your muscles will shrink when you go older. So you'll have difficulty doing activities of daily living, like what? Combing your hair, eating by yourself, washing the dishes, climbing up the stairs. No, these things you'll have difficulty, and balance is going to be an issue. So the next is sleep. I think sleep is self-explanatory. If you don't have enough sleep, you'll grow older very fast because you'll be stressed quite a lot, no? So these are three basic things, no? The other ones are substance use, no? This is self-explanatory, common sense already. If you smoke, if you drink alcohol, you're gonna age faster, and these are known carcinogens already, known by everyone. Okay, all right. So when I say this, there's no single pill, there's no magic pill to prevent cancer, but there are a lot of supplements that you can utilize to prolong aging. One of them is actually Simply Nature PPARS.
Yeah.
I hope you can show that picture you showed us in the conference, no?
Okay, I'll look for it by the end of the, yeah, let me see. I'll look for it.
Yeah. Yeah, so everybody can see. It's actually a very interesting picture, really. And by the way, Sir Shyan has been taking PPARS for I think almost 3 decades now, right?
Yeah, almost 3 decades now. From the age of 27, I'm gonna turn 50. Yeah, so 20, yeah, cross the 2 decade mark. Right?
Yeah. Going on. Yeah. So there you go. So aside from Simply Nature PPARS, there are other molecules. No, I'll call them molecules that you can utilize to prolong aging. Okay. However, this area of medicine is still new, so there are a lot of studies on it going on. So don't just buy whatever product is being sold to you. Make sure you confirm it with your doctors. The doctors the best doctors to approach to approach, no, to ask these questions anti-aging are the aesthetic medicine doctors. Aesthetic medicine, because in aesthetic medicine, I think this is one of the topics that they always repeat during their conferences. So there are new updates on this area. Yeah.
All right, I found it. Junie, please allow me to share screen. All right. And while we do that, I just want to maybe we quickly answer the questions that are very direct, like from Rosa. She has a large spleen because of bone marrow cancer, done chemo. What med or supplements, doc, can you recommend for her?
When the spleen grows, when the spleen enlarges, very difficult to reverse. If at all, it can be reversed, no? Yeah,
Okay.
very difficult. The root cause of the disease has to be addressed. However, even if you are on remission, splenomegaly is a disease. I just don't know if it can still be reversed, no? If the spleen can reduce in size. Okay, but definitely there are ways on how we can prevent its further growth. It's by addressing the root cause, which is the bone cancer itself.
Okay. All right, so go for a consult and so that Dr. Jansen can explore more. Okay, can I share screen already? Let me try. Oh, yes, I can. So Dr. Jansen wanted you all to see this one. All right. Yeah. Okay.
See,
so
you see.
So I think and that's 2018 today lang. This house where we take all these pictures. So that's my niece, you see, in 2006. You can see over here, she's a baby, right? And then she's now 13, now she's not 13 years old, she's 19 years old now, look. So it's not just me, it's me and my wife, you can see. So over the years, as she grew up, we pretty much didn't age as much as her. So you will still age, all right? It's not anti-aging, it's improved aging, right? Or delayed aging. So someone actually asked in the Facebook question, made a remark, wanted me to share about aging. So when it comes to aging, mitochondrial activity and health is one of the focus today. So if you ask any anti-aging doctor, like I have a friend, Dr. Joel Lopez, he focuses in this area. So it's basically keeping your energy level up, right? Your cells are energetic, so they can replicate, they can function well. And if your cells are energetic and healthy, then your skin is also stronger, so it's tighter. So basically, you don't deteriorate, so you maintain a youthful look and movement and energy level. So this one, the best product is actually just a tablet. Really, see, you don't have to buy the most expensive one. It's just the tablet, but eat it regularly. So in my case, how many tablets do I take? I take 20 micro tablets every day. Okay, I take every day. Okay, and I'm a guy, so am I very disciplined about it? I'm not disciplined about splitting it 10 twice, 10 micro tablets twice a day. I'm one of those lazy guys because I'm not sick, right? So I guess less disciplined. I take 20 micro tablets, one shot in the morning every day. Right. And if ever I feel very, very tired, then maybe I take another 10 more just to perk myself up. Right. Just like when you drink coffee, I take my PPAR tablets. Okay, there we go on the anti-aging part. And Doc Johnson, you are so bogey, so you have to maintain the anti-aging also, all right? Sayang if
I
you
hope
lose
so.
your
I hope so.
bonus, right? Don't lose your
I hope
bonus.
so. I hope so.
Yeah, okay. Okay, I
Um,
think that's a good diversion from our very serious topic, which is
lung
cancer.
cancer.
Let's go back and answer questions our viewers have on cancer.
I just want to quickly say that everybody will be delighted to know. It's simply you are looking like that because it's simply because our PPARS has a lot and has high content of antioxidants. That's why.
Yep.
Okay. All right. So for our next question, going back to our topic, lung cancer, coming from Miss Amy. I am a stage 4 lung cancer, taking chemo drug osimertinib. What advice or what PPAR protocol can you recommend to me?
Wow, wonderful, Doctor.
You have to go for a consult. It depends. It
Oh.
depends, no. But I'll give you a range of products, no. The tablets has to be there definitely, but it can be the powder or the liquid. I have one patient with a similar case as you, no. Also took osimertinib, but Dr. Jimmy shifted her to another medication, no. So right now she's taking liquid. So it's a combination. The treatment is a combination of high dose IV vitamin C, PPARS liquid, and erlotinib. If I remember correctly, it's erlotinib, no? So she has lung lesions as well, disseminated at that. A lot of the lung lesions actually disappeared already. The one that the main tumor was actually 3 centimeters. It went down to 2 centimeters.
Wow.
So this is on a 78-year-old lady.
Wow, 78-year-old lady. Wow, fantastic. You would think that a 78-year-old lady, their immune response would be old, not so vibrant, right? So again, what a wonderful for all our viewers, you should not miss it. Dr. Jimmy Katapia, whom Dr. Johnson is talking about, and Dr. Johnson together face to face in a location, So next time we have a SMX event, please come so that you can really experience a real interactive session with both of these two wonderful and experienced and successful doctors, especially with their patient cases. Yeah.
I agree. All right. So for our next question, coming from Ms. Elena Antonio, which has less side effect, tamoxifen or anastrozole? I have stage 1 breast cancer, operated last January. No chemotherapy, one-time radiation only. Which has less side effect?
Which has, okay, on my experience, anastrozole has more side effects. My experience, okay? Tamoxifen is, the patients can tolerate tamoxifen better. Because when you take tamoxifen, no. Yeah. When you take tamoxifen, it feels as though you are undergoing menopause. Anastrozole has a similar effect. However, your bones is gonna be painful. That's one of the side effects of anastrozole. And one of for anastrozole, the side effect is osteoporosis. So you have to also take something for that as well, no, if you are on anastrozole. So for me, anastrozole has in terms of expenses, it's gonna be more expensive. For tamoxifen, the side effects are a little bit milder. However, one of the major side effects of tamoxifen is endometrial cancer. Okay? So both drugs has its downsides. However, between the two, tamoxifan's side effects are a little bit better. Okay, so why am I saying it's a little bit better? You just said endometrial cancer is a side effect. It's because the endometrial cancer is very uncommon. But if and when a patient do develop endometrial cancer with a history of taking tamoxifen, it is because of the tamoxifen. Okay, so yeah, those are my experience on these two medications.
Yeah,
Wow,
actually,
yeah, it's
go
such a
ahead.
privilege, when Dr. Jansen shares like his personal experience with two very commonly used drugs. It's like you get an inside track to what the doctor is thinking. So you guys are very privileged tonight about that. Yeah.
Yeah,
Uh, yeah.
I was about to say, because we have a lot of patients who are also on the 5-year journey of their medication for breast cancer. And a lot of them are actually commenting that they don't look sick. They don't look like they are cancer patients. That includes my dear Miss Claudette from Bicol. Hello. Right. Okay. Well, next question that we are having tonight. Just a second. Okay. Okay. Last 2022, I was diagnosed with breast cancer stage 3B, but I did not proceed with the biopsy. The the lump actually exploded or ruptured, and then
Wow.
yeah, now I feel a lot of pain. I am recommended to do a PET scan. The question is actually how to go to your clinic. And I guess what are your advice for this such condition?
I have to see you first. Okay, I have to see you first because right now there are a lot of problems now going on, and I have to address the ruptured tumor first. Okay, so I usually use ozone therapy for that to dry up the wound. Okay, but of course we have to also consider other treatment methods, no, to address the cancer itself. And of course, another question is, are you considering chemotherapy as well? So if you are, then that will also influence my approach, no, how I will support you if you're considering chemotherapy. But right now, I really do advise you to consider chemotherapy. Okay, because at this stage, the cancer is disseminated already. There are very limited treatment options available already for you. And I really hope that you're still strong enough for you to undergo the chemo.
And if you are not strong enough, Dr. Johnson has so many experience with patients who were too weak to continue with their chemotherapy. And that's how actually Dr. Jimmy Katapia first worked with us at Simply Nature. He had a patient who could not take the chemotherapy, but through the liquid extract, she got strong enough to take the chemotherapy. She went through all her chemotherapy, and today she's doing well. I also want to thank this viewer for sharing her story, because this is a question many of our viewers ask us on our program, right? Should I go for the biopsy? Do not ignore lumps that are growing in your body, right? Just trying to be positive is not going to be enough. You should be doing something. So, for example, if you're a person that really wants to go natural, right? You don't like to go to the hospital, you want to do anything, you should at least, let's say, be taking the Simply Nature Pipa extracts. But you shouldn't just take the Simply Nature Pipa extracts and then tell yourself everything is okay lang. No, it's not like that, right? You take the Simply Nature Pipa extracts, but you still got to monitor whether the growing, is it getting harder? Is it getting softer? Do you feel other tumors happening? And that's why, at the very least, going for diagnostics, once you are on a protocol, once you're on a treatment like a protocol like Simply Nature Pipa extracts, or even vitamin C drip, if you're totally natural, right? It's important. I think this is just something I want to encourage other viewers, because this viewer so honestly and so selflessly shared her journey, and I think it's something that we can all thank her for and also learn from. Do not ignore identifying what's wrong, right? When it comes to cancer, the more you wait, the harder it is to treat. And sayang if you suddenly realize that if stage 1 cancer for breast cancer is like 95% treatable. You don't want to miss this golden period in your life, right, of the cancer where it can be treated. Just like what I shared earlier in the program today. Me and my siblings just discussed over dinner. We go ahead for mom to go for the shunt because we are so afraid of having dementia for her. So preventive is definitely, yes, nobody likes surgery. My mom is 75 years old. We don't want her to go on surgery also. But we were also thinking the doctor is in his, I think, early 60s. He's the top neurosurgeon. I don't want him to get older either. Better have him when his surgery skills is at a peak, right? So again, to all our viewers and to this particular viewer, please see Dr. Jansen. I have great confidence in Dr. Jansen that he can help you in your current situation and that it is hopeful. All right, as you heard from Dr. Jansen, they have very difficult cases. He works with Dr. Jimmy. So if you want to go for chemotherapy, I think that's a wonderful tandem. The two doctors already know one another. They can support one another. So yeah, please. And thank you for being on the program today. And thank you for sharing with us your journey. And thank you for allowing us to contribute. Yeah.
I agree. I think a lot of our viewers wanted to ask questions but are just shy. So the questions that are actually throwing tonight can relate to our other viewers. Now, for our next question, okay, how long does a cancer patient should take the PPARS?
Oh, as long as it takes. Yeah. This is Simply Nature PPARS is not a medication, okay? It's a supplement. So as long as you're on treatment, you can be on it, okay? It's just that we use the different products depending on your situation. What is your health status? What are the treatments that you're undergoing? Yeah. So that's my basis on which product to select. How sick are you? So that's also another consideration. Now, typically, for a cancer patient, I start them on a combination of the tablet and an extract. No, it can be the soft gel, the liquid, or the powder. So depending on what the other doctors are doing on the patient, depending on how healthy the patient is, I can ask the patient to stay on the liquid for 6 months, 1 year, 2 years. Sometimes I ask the patient to just be on the liquid for 10 days, then shift them to the powder. Okay.
Yeah.
Sometimes I ask the patient to be on the powder first, then shift them to liquid. Okay. So it really depends, no? However, as long as the cancer is still active, then you have to be on some sort of extract. So once you're already on remission, I even ask the patients to stay on the tablets as long as possible. So if possible for 5 years, at least for 5 years. Okay, because as you can see, no, again, aging is the most important risk factor. No, it's a major risk factor for developing cancer. So as you age, no, as time passes by, this is a very significant factor which can influence the recurrence, everything, no. So if you are on the tablets, at least you're gonna have some sort of anti-aging protocol with you. All right. So this is the basis, no, on why I usually ask the patient to stay on the tablets at least, no, for as long as possible. What would be the decision point? Finances. If you can't really afford it anymore, then that's the time that you have to stop, no, decrease the dose or stop altogether and look for another product. Okay, but as long as it's affordable, then yeah, stay on it for as long as possible. You can see, Sir Shyan here have been taking PPARS for 27 years already. So look how young he is.
I just remembered one of our attendees last Saturday won our merchandise because he guessed your age, correct?
He guessed my age young. I was so happy with him. And actually, I'm here in Singapore attending a conference. And then during the conference, I made one statement. I just said, 50 years old is the new 50 is the new 30. And then And then after, when I finished my segment, everybody came up to me. A few people came up to me. I won't say everybody. Many people came up to me, were shocked. You are 50 years old? Yeah, you know. So yes. So it's not only, I always want to encourage cancer patients, it's not just about fighting and being victorious over cancer. It's getting your health back, right? Getting your health back means being energetic and being able to enjoy life and be able to participate in life. So yeah, anti-aging is or improved aging or aging well is another good idea or focus to have in your fight against cancer.
Yeah. Both your answers were actually very encouraging. I just want to also share that, Sir Sean, that we have a lot of VIPs who are taking our PPARS for quite a long time.
Yeah.
And they actually started off with extracts and now they are on tablets. But not only them, but it's actually the whole family who's taking the PPARS.
Wow, right? It's the cancer patient who started, but it ended up the whole family. I have actually a family that does that. It's one of the most famous families in Philippines. They are actually the people who build Philippines. They are in the development. Yeah, it started with the sister who had cancer, and then the dad who was a very serious diabetic with 5 insulin shots a day. Then they were able to reduce the insulin shot to 2. Then now it's like the extended family, because whenever they buy tablets, they buy 100 bottles. Obviously, it can't just be the immediate family eating 100 bottles worth of tablets, right? So you can see that it definitely is effective and it's helpful. So that's why I think their extended clan or family is eating on a monthly basis. So yeah, just to share with everybody, right? Just to encourage everyone. Yeah.
Exactly. Thank you, Sir Sean. Thank you, Doc Jansen. All right. I guess this will be our last question for tonight. Okay. Coming from Ms. Jhen Ang. Is allergic rhinitis a risk factor of lung cancer? Thank you.
No, no, no. Allergic rhinitis and lung cancer is not related at all. Don't you worry. Don't you worry. Allergic rhinitis is, well, it's,
What's that?
sneeze. You sneeze, no? Rhinitis is your allergies, yeah. Allergic rhinitis from the term is with rhinitis. Rhinitis is when your nasal passages gets inflamed. And the reason is allergens. So as a result, you sneeze, you have runny nose. Why do you have runny nose? It's basically a defense mechanism of your body to flush down the allergens that is present in your nasal passages.
Yeah.
Allergic rhinitis usually goes away in the afternoon. So every morning you can have this. Why? It's because of temperature. Yeah, your body temperature changes when you wake up. Okay. Actually, when you are asleep, your body temperature increases. So try to notice your family members, no, your friends, when they are asleep, try to feel their skin. They are warm. Yeah, okay. Yeah, try to notice this. No, when you wake up, your body temperature will go down. Okay, so this temperature change, and of course, no, from how should I say? From early in the morning, when it is still cool, then suddenly, when the sun rises, the environment warms up, no, temperature increases. This also can be a trigger for allergic rhinitis. Okay, and of course, you have to clean your room. If you have frequent frequent episodes already, dust is a very significant allergen, and not only dust, no, even molds. Yeah, okay, so you have to clean your room. So these things can result to allergic rhinitis. Lung cancer is different. Lung cancer is when it's already a complication. So risk factors for lung cancer would of course be smoking. Another one would be exposure to secondhand smoke. And that includes inhaling the polluted air, no? Polluted air, even if when you are not smoking. Another one is occupational risks, no? So if you're a chef, if you're working in construction, if you're working in chemical plants, no? These occupation, if you are a traffic enforcer, if you're a GP driver exposed to, no, to air pollution regularly, then these are risk factors for you developing lung cancer. And of course, genetic factors as well. So risk factors are quite different. So they're actually not related at all. Okay, so
Yep.
I hope this assures you, no, reassures
Yeah,
you
totally.
not to.
And I also noticed with allergies, we can grow out of it. We can grow out of it.
Yes.
And it's actually your state of health, right? So my first advice to you is take Simply Nature PPAR tablets, because that's just a general approach to your first step in getting yourself healthy, right? Triggering all your PPAR pathways, and giving yourself a superfood so that you grow stronger and you can grow out of it. The other one is actually literally like changing some lifestyles. For example, Doc, that's the truth. I used to be like 100% meat eater. My vegetable is potato and tomato ketchup. All right, but no. Right now, I've actually really changed. I eat like one meat dish a day. So last time is breakfast steak, then a burger lunch, then another meat dinner, right? Now I actually can have two meals totally vegetable based, right? So, and then like I said, like what Dr. Johnson said, is that at some point, variety in your diet is still important. So then I take meat, but usually I take meat in the afternoon so that I can burn it off instead of at night. So at night I tend to take vegetables so that it's easier for me. And I noticed, you know what, Doc? After taking less meat, the allergies lessen.
Yeah.
It's like you get stronger, you get healthier, then your body doesn't when you wake up, you don't feel that sneezing thing anymore. Now I get allergies only when I'm irritated by some dust or something. So keep the house clean. Very good advice. Thank you.
It's actually a valid question because, it's a cold season and
Yeah.
by the way, this week actually is the start of a lot of schools first day of class. So get your
I think very important for all the parents, you can't, you may be keeping your house clean and everything so your kid doesn't get sick, but it doesn't mean that other people do that. So when their kid gets sick, then they pass on, they become great incubators for a lot of viruses, and then they pass it on to your kids. In Singapore, another very big concern is always the hand, foot, mouth disease. Yeah, because it's very infectious. So again, you one of the good things that you can do is to strengthen your child's immune system so that when they go back to school, they can deal with the virus. You can't ignore it, right? I mean, you can't prevent your children from the mask won't stop it, because kids they're gonna play, right? It's gonna come off, right? So I think supplementing your kids as they first go back to school is very good, because they're going to be first introduced into a environment with lots of new viruses and bacteria that was not from home. And of course, if they are exposed to it after some time, their immune system also recognizes it and they build a stronger immune system. So I guess the first few weeks of school is really important that you supplement them. I think the first thing that you do is you think of is vitamin C. I will let you know that yes, it's a good step. PPAR tablets are more complete, right? But it's good to add to have both. It's even better. It's good to have PPAR tablets. It's even better to have PPAR tablets and vitamin C, right? So yeah, do that for your kids, right? At least for the first month when they go back to school.
Sir Fan, Doctor, I know that what I said a while ago, that's the last question, but can I just
Go. Last one.
I think you can answer these two questions quite fast. Okay. So for the first question, Doc, is it really not allowed for a breast cancer to take or to eat tofu or tokwa?
Good
yes
question.
or no? Yeah.
Good
Yeah,
question.
this is not true, no? If you're a breast cancer patient, all the more that you have to eat soy foods, because consuming soy foods, no, when you have a breast cancer diagnosis, will give you a longer overall survival. And if you are on remission, you'll have a lower risk of recurrence. So you actually have to consume tofu because soy isoflavones are very good anti-inflammatory molecules, no, that combats that fights breast cancer as well. So yeah, this is an olden this is an advice usually given in the olden days. Okay. Nowadays, the recommendation is different anymore. This has been debunked. Okay. Actually, if you just type in your Google search, soy foods and breast cancer risk, you'll see there a lot of articles, no, from reputable sources that yeah, consuming soy products can actually reduce your risk of developing breast cancer by 30%. And if you already have a diagnosis, no, of breast cancer, it can even prolong your overall survival and yung reduce chances of recurrence if you're on remission. And if you are on chemotherapy side effects will be less as well.
From there. Sir
Yeah, I think the misunderstanding came from the very simple where maybe the normal network marketers in their health talks or whatever, right? Yeah, because soy has estrogen, and I think at some early point everybody thought that excess estrogen is why you have breast cancer. And then this linked up, and anyway, it's debunked. So let's go to the next question.
Last question for the day coming from Ms. Dalins. If you are diagnosed with pneumonia, but you have shot of pneumonia vaccine, are you at risk of lung cancer?
No. Pneumonia and lung cancer are totally different diseases which are not related at all. Okay, pneumonia is an infectious disease.
Yep.
Actually, pneumonia is a complication of a lung infection. Okay, when your lungs get infected, no, by a virus or a bacteria, usually we don't see an increase in lung cancer risk. Okay, we don't usually see this. So pneumonia and lung cancer, pneumonia vaccine and lung cancer are not related at all. It will not increase your risk of developing lung cancer.
Excellent. Thank you.
But in our SMX, we noticed there was a question that came out, and we, all the panelists wanted to highlight to all the attendees, is this: we've had cancer patients who had breakthroughs, right, Doc? They had breakthrough, tumor shrank, everything's okay. Then they got pneumonia and died from pneumonia. That is that is so that is so frustrating.
Yeah.
So you
True,
got to
true.
take care of your immune system. So again, to all our viewers who are who are fighting cancer right now, fighting cancer, some of the protocols can leave you drained, your immune system tired out, because you're really fighting something that is tough, right? So you have to pay attention to lifestyle, supplementation to help your body replenish quickly and rebuild your immune system, refresh your immune system. I'm using very layman terms. That, of course, the whole process is but it's a little bit more complicated than that. But the way you actually do it is very simple, right? Live well, eat healthily, do exercise, brisk walking, and all that, and take the right supplements to assist you, because it's so hard to eat healthy in today's world. You can try, but it's not easy to succeed. Right? You go to McDonald's or Jollibee, it's very hard to become healthy based on the menu over there. There are some better choices in Jollibee and McDonald's, but imagine if you're just eating things like that, or Jolly Jeep, it's not easy. So that's why supplements are really a real strategy for you to keep yourself healthy, no matter whether you're fighting cancer.
Exactly. I couldn't agree more.
Yeah.
Well,
By the way, I just want to clarify, kasi with the viewers comment, okay, you have to be careful in analyzing what he said, So again, I'll just repeat, the question was, if you have a diagnosis of pneumonia already, you still don't have lung cancer at this point, okay? So will the pneumonia, and you are vaccinated with a pneumonia shot, will this lead to an increase risk of lung cancer? No. Okay, no. However, if you have lung cancer already, this can lead to pneumonia. Okay, so now in this sense, you have lung cancer, you have a lung tumor. Yeah.
You shouldn't be taking a pneumonia vaccine.
Actually, the pneumonia vaccine will not have any effect at all. You know why?
Oh,
Because the lung tumor will destroy the defense, the natural defense mechanism of the lungs. It will destroy the architecture. So once it destroys the architecture of the lungs, fluid will ooze out of the lungs. No, that will fluid will fill your lungs. That will show as pneumonia. Okay, that will become pneumonia actually. So when your lungs fill with fluid, of course, when the architecture of the lungs gets disrupted as well, bacteria can go inside your lungs and cause infections. Okay? So in this sense, pneumonia is a complication of lung cancer. Even if you get vaccinated for pneumonia,
oh, you will
you
still
will
end up
still
with
get,
pneumonia
yes, you will
because
still
it's
get,
not a
you
viral
will still
infection.
get, yeah, it's not an infection. It's
It's the
because the
effect of the lung.
architecture, yeah, it was destroyed. It's because of the lung cancer. Okay, so I hope you understand though when I with my answer a while ago, so as not to cause any misunderstanding. Okay, so there you have it. I'll give the floor back to Sheila.
Yeah.
So at least we know that there's consideration if there is lung cancer or there's no lung cancer. All right. Well, thank you. Thank you so much. Your answers today were very, very helpful and very informative for our viewers. As you know, before we say goodbye and before I invite them to our next webinar, I'd like to ask for quick parting words for our viewers. Who would like to start?
I'll start first because I'm in
Okay.
Singapore. Okay. Again, thank you everyone. Greetings from Singapore. So thank you for joining us tonight. And tonight we're actually quite long until 9 p.m. So, but yet you're all here with us. You are the reason why we keep doing this. Thank you for your questions. It's a lively discussion today. And as you can see, our programs are very. I think I'm enjoying. No, not lively, but we often able to bring our own lives into this. Just and neurosurgeon I'm able to share some insights to the audience today too. So again, thank you very much. This is something very dynamic and it's like a community. I really appreciate everyone and I'll see you guys next Thursday. And of course, my buddy, my pare in this journey for more 80 episodes, Dr. Jansen. without you, life would be less colorful. When it comes to doing the program. Yeah. So I'll leave it to Dr. Jansen for his parting words.
Yeah, I want to thank all of you, for staying with us until this time at night. I know a lot of you are patients who are already very, very tired. But I thank you for asking these questions. If not for your questions, we wouldn't have, extended the program until this time. Okay. So thank you for the questions. We also learned a lot from the questions that you are asking. So we know how to improve better, no, better improve the program, what kind of webinars, what kind of videos we're going to show for the next episodes. So again, thank you and good night to all of you. Sheila.
Thank you, Dr. Jansen. Thank you, Sir Shyan. On behalf of our viewers, thank you for answering our questions for tonight. And of course, our future questions for our next webinars. Okay, now at this point, I just want to let everybody know that today is the last day of the Sulit Sweldo sale on our Lazada or Laz Mall shop. So please take advantage of that. Check out the participating products that we have for you, for you to try and try our PPARS and also cleansing plus. All right, now, so at this point, I'd like to invite everybody for our next webinar. That's this coming August 8th. Wow, that's 8/8. Okay, guys. So we will also be having the last live 8/8. That's next Thursday at 5 p.m. Please check out or please like and follow our page for you to get updated about that one. But for that day as well, at around 7:30, we will be having our next webinar entitled Managing Diabetes and Hypertension, Avoiding the Past. Okay, now, of course, once again, I just want to say thank you, of course, to our attendees of our SMX webinar entitled, our SMX seminar entitled Beat the Odds, Medical Nutrition, Oncology, Surgery, and PPARS in Fighting Cancer. Once again, your participation and enthusiasm were a vital role in making that event a success. So thank you once again for coming. Okay, so I hope and to see you once again in our next webinars to come, because here in Simply Nature, we are always with you from start to healing. Thank you, everybody. Good night, and God bless you all. Boost your health today with a Simply Nature Power Pack, a 5-day combo pack of Simply Nature PPARS tablet for immune boosting and Simply Nature Cleansing Plus for effective detoxification. Now is the best time to try our Simply Nature products. Available on our official Shopee, Lazada flagship store, our website www.simplynature.asia, and our office in BGC Taguig. Order yours today. Click the link on the description box.
Hi everyone, these are the important questions. Do I need to go for chemotherapy? How many sessions of chemotherapy do I need? What about immunotherapy? What about surgery? What about CT scans? Well, join us on our Simply Healed program every Thursday nights at 7:30 p.m. Singapore, Hong Kong, and Philippine time. Our sessions are interactive, featuring a live Q&A with experts and doctors who will answer your questions in real time. You can type in your questions and get immediate, personalized responses. This is your chance to take control of your health. So take advantage of this informative and supportive experience. Visit our Facebook page and message us on Messenger to find out more. See you there this Thursday.